We're back, and you're listening to America's Voice Now. My name is Michael Evans. I am your host. Thanks for riding with us this morning. We appreciate you. Hey, all those folks clicking over from SGT Report. Man, I watch you guys every morning. Thanks for joining with us. I appreciate you. Share the word with your friends and your neighbors. Let them know that they can listen to America's Voice Now streaming live here every morning. They're listening and capturing us from SGT Report on our website, americasvoicenow.org. I see a number of you guys every morning. Glad to have you. The issue of the HHS website this morning is important, and I think I'm going to clarify for you what the procedure or the process is to get into Obamacare. First and foremost, there are 36 different state exchanges that the federal government is either fully responsible for or partly responsible for. And the reason for that is because 30 states have said that they're not going to run an Obamacare exchange. 30 out of 50, folks. So don't let anyone tell you that the vast majority of America wants this. 30 states have said, we don't want any part of running it. Right off the bat, that ought to tell you a lot. If you've got 30 states that say they want no part of Obamacare, you got to wonder what the deal is with that. In other words, 30 states have come out and say, look, we're not going to run some kind of a state exchange because you guys don't have your act together. Our citizens don't want it. They've spoken clearly. They don't want Medicaid expanded in our states. And so if you're going to do something, you're going to have to do it without our participation. 30 out of 50, ladies and gentlemen. Why isn't the mainstream Ministry of Propaganda telling you that? You got to ask yourself that question. So this morning, as an experiment, yesterday I went on there. And the first thing they did was refer me to the Missouri HHS website, which is where you apply for Medicaid, or Medicare, Medicaid. For the record, by the way, the difference between Medicaid and Medicare are two different things. And if I interchange the wrong phrase, forgive me. It's just, I'm talking and thinking and writing and reading all at the same time. Medicare is for seniors and Social Security recipients who have reached 65 or older, or I think it's 67 now. And it is the retirement health care program for seniors, for the most part. There's other exemptions and exceptions to the rule, but for the most part, it's what you get when you hit retirement age and you get Social Security. If you want to have a stopgap plan in between, to cover the deductibles, you buy a stepping stone plan that enables you to cover the gap. Okay, Medicaid, on the other hand, is a completely different animal, and Medicaid is generally funded by the states, partially, along with federal monies. And Medicaid is directed towards the indigent, the poor, and children's health care for those who can't afford health care for their children. Okay? It's also for those who are on disability and those who, for whatever reason, are unable to provide for their own medical care. They can't afford insurance, they're unemployed, whatever the case may be. It's for the poor and the indigent. That's the simple lowdown. And what they're doing with Obamacare, the plan is, and this is the stuff they don't really tell you about when you hear about it on the news, or, most people aren't giving you in-depth understanding of what's happening with Obamacare. But the truth is this: if you do not qualify based on income to buy in an open, free enterprise exchange of insurance companies, they punt you off to the Medicaid rolls. And the Medicaid rolls have a couple of rules. First of all, the way Medicaid operates in most states is you can only have so many assets, so many dollars, and so many equity assets in order to qualify. So you can have a primary home, but you can't have two homes. So if you've got a weekend or a vacation home, you can't have a vacation home and get Medicaid. You also can't have so much money in the bank and things like that. And so what happens with a lot of seniors is they get older, they try to figure out ways in which they can get away from the onerous implications of Medicaid because they know that they're going to need nursing care and services and maybe assisted living and things like that. And the only way that that can be paid for is if they bury their assets or get rid of their assets. Now, here's the real rub with Medicaid. Let's assume, for argument's sake, that you're on Medicaid because you don't have a job or you fall below the 133% of the poverty level of. For a family of four, it's like $26,000. So if you make like $36,000 or less, you are not able to buy from the open exchanges where you're dealing directly with an insurance company. You're kicked off into the Medicaid rolls. And most states have decided not to expand their Medicaid. The federal government came out about a year ago and said, look, we'll fund it for the first 3 years. We're going to fund 100% of all your Medicaid for the first 3 years if you do this with us. If you expand Medicaid to take on all the Obamacare patients. And a lot of states wisely said, no, I don't think so, because the problem with that is that we recognize that what you're really going to do is at the end of 3 years, you're going to say, oh, the funding's ended because we're in a budget crisis or some other nonsense. And then we're stuck carrying the cost of that as a state indefinitely, forever. And so most states said, we're not going to do that. Now, a number of states did accept it. And those states, you'll immediately be kicked off of the Obamacare open exchanges into the state Medicaid rolls. And the problem with that is that, one, Medicaid is notoriously lousy health care. I mean, they send you to the worst clinics. There's very few doctors that want to accept it. The amount of help that you can get, the references off to a specialist are virtually non-existent. The hospital care is awful. Everybody knows that Medicaid is like it's worse than VA. And VA is the pits. Veterans Administration. The worst part is, at the end of the day, after it's all resolved and you've been on the Medicaid Obamacare roll, what will happen is if you ever sell the home that you're in and you've got equity in it, they can go after that equity to compensate themselves back for what they've spent on your behalf. Nobody's telling you that. Nobody. Why? Because the poor people in the United States of America, even though they may own a home and they may have a little bit of equity in it, they're poor. I mean, because they don't have a lot of income, right? But the truth is, these people would revolt openly. If you told them that the $20 or $10 or $30,000 of equity they've got in their little shoebox is open to being seized if they ever sell the house, they'd be like, well, I'm not applying. The game plan here is to keep that a secret, because there are a lot of folks in the United States of America who own a house that's worth, let's say, $100,000, even in these depressed market times. But, they didn't buy it at 125% of value with 172% of value mortgage. They bought it years ago. They put up, $20,000, $30,000. They've been diligently paying it off. And now they own a $100,000 home, and they might have $20,000, $50,000, $70,000 of equity in it. That's all subject to being snatched away from you if you take Obamacare's Medicaid option. which isn't an option. They don't give you another option. Medicaid users are subject to having their assets seized. Do you get it, ladies and gentlemen? Now do you know and understand why the Ministry of Propaganda is refusing to tell you the truth? Why they're omitting? And a lie by omission is still a lie. Because the millions upon tens of millions of poor Americans who are going to qualify for subsidies for reduced or free health care, it's not really free. They're just going to get their money later from you. Now, the true indigent, those who rent and don't have two nickels to rub together, a pot to pee in or a window to throw it out of, those folks are, for all intents and purposes, judgment proof. And they'll willingly sign up and be like, hey, it's just free healthcare. What do I care? But there are literally tens of millions of Americans whose few little tiny assets, their widow's mite, are at major, major risk. What they've worked and slaved their entire lives for is subject to confiscation. That, ladies and gentlemen, is inexcusable. And for the mainstream media, the Ministry of Propaganda, for HHS itself, and for your own states to not tell you that is a betrayal that is so immense. Every one of those 10 million people who have some small pocket of equity somewhere should be outraged to the point of marching on your state and your federal capitals. Massive, peaceful, civil disobedience. I won't sign up. I'm opting out. You're not participating in this, and you're not going to take what little bit I've got. How else to take everyone and make them totally indigent, and therefore, guess what? Totally dependent upon a brand new drug being issued to you by the federal government of the United States of America. Ladies and gentlemen, that's what this is. It is nothing more than a brand new issuance of a brand new drug that has got an addiction rate of 100%. And when your dealer owns you, you'll sell your soul to get more. You'll give up your equity in your property. You may not even have known you were signing it away. Read the fine print carefully when you get this Obamacare, those of you who are going to apply. Frankly, you should opt out. You shouldn't even sign up for it. But there are those who are going to be determined, and there are those who have pre-existing conditions who have been waiting for this day because they need immediate medical care. I understand that. I'm telling you to look at and read the fine print. Watch, and if you don't understand it because it's legalese and it's intentionally written so that you won't understand it, then give it to somebody who will. But read the fine print. Because I'm telling you right now, if you get kicked onto the Medicaid rolls, your assets, what little bit you may have, is gone. I don't understand why attorneys around this nation are not standing up and educating the people around the nation about it. Because it would be cause for a class action lawsuit of unimaginable dimension. 10 million, 20 million Americans saying, I'm a part of this class action lawsuit. You've defrauded me of what little equity I may have had in my home. My family farm is at risk. It's been in our family for 100 years. The little house I have on the corner of North and Main, that little shoebox. Yeah, it's barely big enough to contain us. It's worth 100. We owe 37. 63,000 is at risk. Yes, it was worth 130 before Obama took office in the financial collapse. Now it's only worth 100, so you already lost 30 grand. Now the other 67 is going to be seized from you. confiscated by your own government. Welcome, ladies and gentlemen, to the police state. That's what this is. All right, we're going to take a break. When we come back, we're going to talk about how Obamacare this morning opened and shut because, frankly, they can't. They couldn't keep it running. It's crashed. You can't even apply. Oh, and I want to tell you something else. One of the requirements is you must have an email address. You cannot apply unless you have one. We're going to talk about that when we come back. To me, I mean, that's so injurious to the folks who live in rural America. I can't think of anything that's more reprehensible. These folks can't even get dial-up. And you're going to demand that they have an email address in order to apply. Is that really so that the NSA can have one more source to add to the dossiers? You betcha. You're listening to America's Voice Now. Find us on the web at americasvoicenow.org. You can find us on facebook.com/America's Voice Now. We'll be returning in just a moment. Stick with us. This ought to be an interesting segment.